Everybody of us at some point of time will get knee pain. Lucky are those who don't. If you get knee pain, you've got to identify what caused it. If it is an injury, if it is a trauma, then the cause which gives you the knee pain is different. But if you don't have an injury, if you don't have a fall, you've not tripped while playing or something, then you're probably dealing with a knee degeneration, that is knee arthritis. And this is usually seen in the elderly age group above the age of 50, 55, 60. What happens then? The knee has a cartilage. The cartilage starts getting degenerated and the bone rubs against each other and causes pain. This is called as degenerative osteoarthritis.
So this is a condition in which there is a wear and tear of the knee joint which starts to happen commonly in the middle age, and there are probable multiple reasons why it happens in the middle age. So in many patients it depends on the age. So as we rightly said, the middle age patients are affected because of the aging process which begins in the body. There are certain metabolic changes that happen in the body, and gradually the knee cartilage, which is a protective mechanism on the knee joint or the knee bones, which protects our knee joint from friction and wear and tear, start showing some changes. And these changes, they gradually increase step by step, ultimately leading to a severe arthritic knee joint. So age is one of the major factors which predicts the outcome of the knee arthritis. Second common reason, or what the questions patients have or people have in common, is heredity. My mother, my dad, my grandmother, my parents have knee arthritis. So am I predisposed to have knee arthritis? Yes, my friends. So there are certain hereditary conditions like genu valgum or genu varum, like bow legs or knock knees. In such patients, developing knee arthritis is very common. So hereditary to certain extent has a bearing on the knee arthritis. Next, coming to the next topic, next cause, probable cause, is weight. So yes, my dear friends, weight is a very important factor which predisposes our knee to maximum stress in our day-to-day lifestyles, in our professional lifestyles. And yes, if you are overweight, which can be easily found out with the help of calculating your body mass index, and if your body mass index is more than 25, then you classify to be obese, and if it is more than 30, you classify to be overweight. So if you are overweight or in the obese category, the predisposition to have knee arthritis is very high because of the constant strain on the knee joint coming in our day-to-day activities. Third most common reason why a knee arthritis happens is due to injuries. So many of the times, due to our professional habits or personal habits, we indulge into many sports activities, and we a lot of times get minor repetitive injuries around the knee joint, and these injuries predisposes our knee joint or the knee cartilage to traumatic wear and tear and subsequent development of knee arthritis.
It's not necessary that all the time you have to go to a hospital, go to a doctor and take treatment. There are many things you can do at home itself. So certain exercises, nowadays if you go to the YouTube channel, there are certain good exercises. You can see that and you can do it. You can wear some knee braces. You get some nice knee caps. You can wear the knee caps. That will give you some relief. You can put some ointments. You get all these ointments which are available without prescription. You can use those. Sometimes some painkillers like Voveron, Combiflam, these are available. You can try that. So home remedy for a certain period is okay as long as you're getting better. Means it should not be ki aaj gudga dukla and tomorrow immediately you're going to a doctor, you're panicking. Don't do that. Home therapy, which I just told you, wearing knee braces, putting ointment, putting ice, taking rest, doing certain exercises is helpful. But if the pain doesn't reduce in 3 weeks, let's say, then you have to take treatment from a doctor, get the diagnosis and get it shown. So home remedy has the role which I said. Do it, but with caution.
See, there are multiple things when we are going for a surgical option for any kind of ailments which our body is suffering from. So what we call usually is, this is not an emergency operation. It is usually an elective operation. That is, whenever the patient is having too much amount of pain, there is too much amount of deformity, or the patient can't walk a couple of steps on his own or without pain, that is the time when we start thinking about a knee replacement surgery. But before that, we have to understand and clinically examine the patient, where we grade the patient in what exactly condition, what exactly stage the patient is in, whether we can offer him a knee replacement surgery. So there are 4 grades basically: grade 1, grade 2, grade 3 and grade 4. So usually in grade 1 and grade 2 we resort to most of the conservative management, that is exercises, precautions in their daily life, there are lifestyle activities modifications and medications, and sometimes also injections. So these are conservative line of management. But whenever the patient is having too much amount of pain, as well as his stage of disease is in grade 3, grade 4, which is the terminal point, that is the time usually when we advise the patient that he should get a surgery done. But all said and done, as I earlier mentioned, it is an elective surgery. So whenever the patient is ready to undergo this surgery, whenever the patient wants relief of pain, whenever the patient wants to walk properly, they want to do their daily activities, that is the time when we offer knee replacement surgery.
What is the last message to your patient of arthritis?
I think what is important is early diagnosis, early recognition. Once you get some problem in your body, may it be knee pain, may it be shoulder pain, or for that matter anything, you're getting fever, you're getting some abnormality and your body knows कि आता काहीतरी त्रास होतोय. So don't sit on it. As I said, 1 or 2 days, 2 weeks, home
That's fine,
remedy
yeah.
is fine. But if your fever is not going down, if your pain is not reducing, then seek early medical attention. Get a proper diagnosis done. And once you get a proper diagnosis, then the treatment will follow. So that's point number 1. So early diagnosis, early treatment. The second message I want to give is, even if you get pain, you can do all this. But what about patients who don't have pain but are in that vulnerable period? So prevention is better than cure.
Yeah.
Now what is the preventive measures you can take? One is daily some kind of a routine, daily exercises. Go for a morning walk, do physiotherapy exercises, do some kind of a sport, go for swimming, go for cycling. So these are things you should have in a routine. Diet has an extremely important role. There are certain foods which don't suit patients. So patients tell me आज थोड़ा आंबट खाल्लं, if I eat something like this, my pain increases. So there is no specific food which increases arthritis, but if the patient knows that particular food is increasing his pain, he should avoid that food. Keep the weight less. If your BMI is around 25, be sure you'll be fine. So weight has an important role. And the last thing is, you should have a stable mind. You should have a calm, quiet mind. You know, if you are able to tell yourself that this pain is there, but I'm going to bear it. So how do you develop a calm, stable mind? The way to that is some kind of sadhana, some kind of meditation, some kind of prayers. So find some way where you can relax yourself, and that is very, very personal. But find a way, and thereby if you have a calm mind, you can definitely help to prevent arthritis, prevent pain, and even if you get arthritis, you can manage it in a better way.